We all know how important breathing is. It's something we do without even thinking about it. But for millions of people around the world, breathing isn't always easy. It can be a struggle, a source of anxiety, and even a life-threatening condition. Today, we're going to talk about two common respiratory illnesses that affect the airways: asthma and bronchitis. Both asthma and bronchitis can cause similar symptoms like coughing, wheezing, and shortness of breath. This can make it difficult to tell them apart. However, understanding the differences between these two conditions is crucial for effective treatment and management. In this essay, we'll delve into the world of asthma and bronchitis, exploring their causes, symptoms, and treatments. We'll learn how to differentiate between them and, most importantly, understand the importance of seeking professional medical help for accurate diagnosis and personalized care. So, let's embark on this journey to demystify these respiratory conditions and empower ourselves with knowledge for better respiratory health. Asthma is a chronic respiratory disease that affects the airways, the pathways that carry air in and out of our lungs. When a person has asthma, their airways become inflamed and swollen. This inflammation makes the airways narrow, making it difficult for air to flow freely. Imagine a garden hose with a kink in it. The water flow will be restricted. Similarly, in asthma, the inflamed and narrowed airways restrict airflow, leading to the characteristic symptoms of the disease. These symptoms can vary from person to person and can range from mild to severe. Common symptoms of asthma include wheezing, a whistling sound produced during breathing, especially exhaling, coughing, often worse at night or early morning, shortness of breath, feeling like you can't get enough air, chest tightness, feeling like your chest is being squeezed or compressed. Asthma can be triggered by various factors, and identifying these triggers is crucial for managing the condition effectively. Asthma is not a one-size-fits-all condition. It can manifest in different forms, each with its unique characteristics and triggers. Understanding the different types of asthma is crucial for personalized management strategies. Some common types of asthma include allergic asthma triggered by allergens like pollen, dust mites, pet dander, and mold; exercise-induced asthma. Symptoms flare up during or after physical activity. Occupational asthma triggered by workplace substances like chemicals, dust, or fumes. Nocturnal asthma. Symptoms worsen at night due to hormonal changes or increased allergen exposure. Identifying your asthma triggers is crucial for minimizing exposure and managing symptoms. Common asthma triggers include allergens, pollen, dust mites, pet dander, mold, irritants, smoke, pollution, strong odors, cold air, respiratory infections, colds, flu, sinus infections, exercise especially in cold, dry air, stress and strong emotions, certain medications, aspirin, ibuprofen. By understanding your asthma type and triggers, you can work with your doctor to develop a personalized asthma action plan to manage your condition effectively. While there is no cure for asthma, it can be effectively managed with proper treatment and lifestyle modifications. The goal of asthma treatment is to reduce inflammation in the airways, prevent asthma attacks, relieve symptoms. Treatment options for asthma typically involve a combination of medications and lifestyle changes. Medications: quick relief inhalers, provide immediate relief from asthma symptoms by relaxing the airway muscles. Long-term control medications, taken regularly to reduce airway inflammation and prevent asthma attacks. Biologic therapies, newer medications that target specific components of the immune system involved in asthma. Lifestyle modifications, avoid triggers, identify and avoid your asthma triggers, maintain a healthy weight. Being overweight or obese can worsen asthma symptoms. Exercise regularly. Regular physical activity can improve lung function. Get enough sleep. Fatigue can make asthma symptoms worse. Section 5. Bronchitis unveiled. Inflammation in the airways. Unlike asthma, which is a chronic condition, bronchitis is an inflammation of the bronchial tubes, the airways that carry air to and from the lungs. This inflammation irritates the lining of the bronchial tubes, causing them to produce excess mucus. The buildup of mucus narrows the airways, making it difficult to breathe. The main symptom of bronchitis is a cough, which often brings up thick, discolored mucus. Other symptoms may include wheezing, which is a whistling sound when breathing, shortness of breath, especially with activity, chest tightness, a feeling of pressure or discomfort in the chest, fatigue, feeling tired and run down, and low-grade fever, especially with acute bronchitis. Bronchitis is usually caused by a viral infection, such as a cold or the flu. In some cases, it can also be caused by bacterial infections or exposure to irritants like smoke, dust, or fumes. Understanding the difference between acute and chronic bronchitis is important for determining the appropriate treatment approach. Section 6. Acute versus chronic bronchitis, a tale of two illnesses. Bronchitis can be classified into two main types, acute and chronic. Acute bronchitis is a short-term condition that usually lasts for a few days to a couple of weeks. It's most often caused by a viral infection, such as a cold or the flu. Chronic bronchitis, on the other hand, is a more serious long-term condition that's defined as a productive cough that lasts for at least 3 months a year, for 2 consecutive years. It's a type of chronic obstructive pulmonary disease or COPD, and is most often caused by smoking. Here's a table summarizing the key differences between acute and chronic bronchitis. Feature acute bronchitis. Chronic bronchitis duration, short-term, days to weeks, long-term, months to years. Cause usually viral infection, usually smoking symptoms, cough, mucus production, wheezing, shortness of breath, chest tightness, fatigue, low-grade fever, cough, mucus production, wheezing, shortness of breath, chest tightness, fatigue, treatment rest, fluids, over-the-counter medications, bronchodilators, inhaled steroids, oxygen therapy, pulmonary rehabilitation. Treatment for acute bronchitis typically involves rest, fluids, and over-the-counter medications to relieve symptoms. Chronic bronchitis, however, requires long-term management with medications, oxygen therapy, and pulmonary rehabilitation. Section 7. Asthma versus bronchitis. Spotting the difference. While asthma and bronchitis share some common symptoms, understanding their key differences is crucial for accurate diagnosis and treatment. Here's a table highlighting the key differences between asthma and bronchitis. Feature asthma bronchitis. Nature. Chronic long-term condition, acute, short-term, or chronic, long-term, cause immune system reaction to triggers. Usually viral infection, acute, or smoking, chronic symptoms. Wheezing, coughing, especially at night. Shortness of breath, chest tightness. Cough, productive. Wheezing, shortness of breath, chest tightness, fatigue, low-grade fever, acute. Triggers, allergens, irritants, exercise, stress, infections, irritants, smoke, dust, fumes. Diagnosis. Lung function tests, allergy testing, physical exam, medical history, chest x-ray, sometimes, treatment long-term control medications, quick relief inhalers, trigger avoidance rest, fluids, over-the-counter medications, acute, medications, bronchodilators, inhaled steroids, oxygen therapy, pulmonary rehabilitation, chronic. It's important to note that these are general guidelines and there can be overlap in symptoms between asthma and bronchitis. Section 8. Seeking expert help, diagnosis, and treatment. If you experience persistent or worsening respiratory symptoms like coughing, wheezing, or shortness of breath, it's crucial to consult a medical professional for an accurate diagnosis and appropriate treatment. Self-diagnosing can be dangerous and may lead to ineffective treatment or complications. A healthcare provider will take a detailed medical history, conduct a physical examination, and order tests if necessary, such as lung function tests, allergy tests, or a chest x-ray. Based on the diagnosis, they will develop a personalized treatment plan tailored to your specific needs. Remember, early diagnosis and treatment are crucial for managing both asthma and bronchitis effectively and improving your respiratory health. Section 9. Breathe easy. Conclusion. Asthma and bronchitis are two common respiratory conditions that can significantly impact a person's quality of life. While they share some similarities in symptoms, they are distinct conditions with different causes, triggers, and treatment approaches. Understanding these differences is crucial for accurate diagnosis, effective management, and improved respiratory health. By seeking professional medical help, following your treatment plan, and making healthy lifestyle choices, you can take control of your respiratory health and breathe easier. Remember, knowledge is power, and when it comes to our health, especially our respiratory health, it's always best to consult the experts.